she is going to talk about her honors mentorship experience and what she's been involved with. So I'll let you take over.
Thank you. Hi, my name is Alina. I go to school here. I'm a full-time dual enroll student, so that's probably why you don't see me as much. I'm a senior this year, and this is my first year in the Honors Mentorship program. I've been involved with some clubs like HOSA, National Honor Society, Medical Scholars, which I just graduated, and Honors Mentorship. So for Honors Mentorship, we were required to have a research question, and I chose to intern at a surgery center. So my research question is related to the sterilization process of the instruments and operating rooms and the surfaces where patients and their families can sit. So I've watched a couple of surgeries in my free time, but I don't really know what happens before or after the surgeries. So my abstract is, my research is about the sterilization process, and I have been interning at Limestone Surgery Center, and I think it's important for people to know what the sterilization process is like, because when you're entering surgery, you want to know what you're going to experience, and you want to make sure that your instruments are very sterile. Okay, so what led to me to choose this topic is I have two younger sisters, and they are very clumsy, and whenever they cut themselves or fall and they cried to me, I had to clean their wounds, but I didn't know how. So I went online and I searched up how to sterile your wound, how to properly cover it, and it involves like hydrogen peroxide, washing it, and putting a clean Band-Aid on. And so that is how I chose the topic of my research. So before I researched, I had to jot down what I already know about the sterilization process. And I know that there are soaps that you have to use before cleaning your instruments for surgery, but I don't really know what the sterilization process was like. So I know that you have to scrub it, make sure it's clean, but what else? I thought that they just throw it in a dishwasher and they take it out and it's already clean, but that's not exactly how the sterilization process is like. So I interviewed the technician that is responsible for cleaning all of the instruments before surgery and after surgery. And so I asked her questions like, what is the process like in the operating room, and what the temperature should be. And fun fact, the reason why it's always so cold at healthcare facilities is because bacteria likes to grow in very warm and moist environments. So when you're opening someone up in surgery, you have to have the room very cold so bacteria doesn't grow inside the cavity, which also leads to infections. And I also asked questions like, why is it important to sterilize the operating room so it doesn't transmit diseases and spread infection? That would be really bad. And then I asked a fun question like, do you vacuum or dust the operating rooms? No one really thinks about that, right? Yeah, so apparently there's a company that comes in at nighttime when all the surgeries are done, and they clean like everything, like the corners of the room, they dust, they mop, and yeah. And there was this cool, interesting fact I didn't know about, that there's something called negative pressure in the operating room. So when you're opening and closing the doors of the operating room, there's something called negative pressure. And what that means is when you open the door, all the air like gushes into the room so that it doesn't spread to the outside of the operating room and causes infections. So I thought that was really cool.
They even spray and disinfect the walls and the ceiling and all of the instruments that come out of the ceiling, so.
So what I learned from my research is that my surgery center uses a device called the steam autoclave. Is that right?
Mm-hmm.
And it's basically this machine where you put instruments in, and it it blows really hot steam to kill the bacteria. And when you think of bacteria, you're thinking of microorganisms, but you can't really see them, right? So how do we know if it's really clean? So like all healthcare facilities, they use something called a biological indicator. That's basically a little strip that tells you if there's microorganisms found still in the little trays that they put in the steam autoclave. And I think that's really cool because I'm sure a long time ago that would take forever to know if something's really clean or not. So that little strip really helps. Okay, so I know this is a lot, but I'll sum it up. So basically the process is like, so after surgery is done, they take it to something called a soiled dirty room. And that's where all like the dirty instruments are, and they soak it in water, and they put something called a enzymatic cleanser, which is like a soap that eats microorganisms. And it's important to soak it because you do not want to dry the tissue and the blood, because it will be very difficult to clean. So they soak it, they scrub it with like a sponge and with like bristles, so you could really agitate it. And then after they wash it, they dry it, and then they cover it, so they transfer it to a clean room. And in this clean room, they wrap it with a special wrap that allows air, like the steam, to pass through and kill the bacteria. And it's important to cover it very well, because if you allow steam in the gap, it'll create a puddle, and that will keep the microorganisms and the bacteria, and it won't be sterile. So that's why it's very important to wrap it very tightly. And I've actually wrapped some myself, and I've had some gaps, and they were like, oh, you have to wrap it more tightly. And it was a difficult process, and it definitely takes a lot of time to learn and perfect. But it's very, very important not to leave any gaps in the foldings.
Mm-hmm.
Oh, also, there are these tapes that you tape the trays with, and they look like this after you steam them. But before, it looks like this.
It looks like a piece of masking tape.
Mm-hmm.
Is what it looks like. And then when the steam gets up to the certain temperature that will kill all the microorganisms and spores, then it indicates it got up to that temperature, and that's what causes the little black lines to form in it. So you're assured that it was sterile.
And I actually included the temperature, and it goes to at least 250 degrees Fahrenheit. So I thought that was pretty cool. Here's my annotated bibliography, It involves examples of hospitals around the world who have dealt with surgical site infections. So that's why it's very important to clean not only your instruments to be sterile, but also your environment, because things like this can happen. And that will cause to you having another surgery to remove the infection, and that's just a lot of money. So it's very important. And I think that's all I wanted to say. Also, at my internship, I work 3 times a week. I work for 4 hours. I'm a full-time dual enroll student, so I get to work in the morning sometimes, and then go to school, and then sometimes in the afternoons. But it's a lot easier to gain experience in the mornings because that's where all the babies come in, and they're so cute, but they're very fast. You gotta, they come in, and then I help with the post-anesthesia care unit. So I help wake the babies up, wipe any bodily fluids that they might secrete, and that's okay. And I also sometimes hold them. They just grab you. It's very cute. They're very fast, and I like it in the mornings a lot better because you really get to see how healthcare field is like. It's very fast, it's very exciting. Of course, there's other healthcare careers that don't involve patient care. So if you're interested in that, I highly recommend the Honors Mentorship. So yeah, and I also learned how to build patient charts from scratch. So it's very exciting to know the histories and of patients and what could lead to possible health conditions now. So